everyone, I am Dr. Supritha Rangaswamy, consultant gynecologist and obstetrician in Cloudnine, Thanisandra, Bangalore. Vaccinations do help us prevent harmful infections. Whenever anyone wants to plan pregnancy, it's always better to know what all vaccines they have to take. First, let me list you the important vaccines which has to be taken before planning the pregnancy. Hepatitis B vaccine, MMR vaccine, Varicella vaccine and flu vaccine. Flu causes various symptoms like chills, fever, sore throat, headache. These are the common symptoms of the flu. Any female who is a pregnant woman who gets a flu in the pregnancy, they are at increased risk of preterm delivery and reduced fetal growth. So it's always better to take a flu shot before planning the pregnancy. And also even in the pregnancy, flu is allowed even in the pregnancy. It is always better to take both prior planning the pregnancy and also in the third trimester of the pregnancy. Next vaccine which I am going to talk about is Varicella vaccine. Most of us during our childhood would have got chickenpox, which is also known as varicella. If you have not got it, it's always better to check your varicella titers in the blood. If there are no antibodies, please do take varicella vaccine in the pregnancy. Varicella causes rashes, itching and fever. So if you have to take the varicella vaccine, it's always better to take it before planning the pregnancy. Varicella, if not taken, then the chances in the pregnancy varicella, it will cause preterm delivery and also congenital birth defects. So when you take the varicella vaccine, plan the pregnancy after 1 month. So next vaccine which I am going to tell about is MMR. It's always better before planning the pregnancy, please get your MMR titers done. MMR contains measles, mumps and rubella. Measles cause fever, rash and cold. In the pregnancy, the measles have increased risk of miscarriage. Coming to the mumps, mumps will cause swollen glands, pain and fever. Even the mumps will also cause increased risk of miscarriage. Coming to the rubella, rubella causes flu-like symptoms. In the pregnancy, there is increased risk of miscarriage, stillbirth, preterm delivery, also congenital rubella syndrome. So it's always better to take the MMR vaccine before planning the pregnancy. So 2 doses of MMR vaccine will be taken with just 28 days apart. And if you're planning the pregnancy, please plan after the second shot after 1 month. Hepatitis B is the next vaccine which you have to take before planning the pregnancy. If the hepatitis B titers are low, you have to take 2 doses 1 month apart before planning the pregnancy. Hepatitis B in the pregnancy causes placental abruption, preterm labor, PIH, hence it's always better to take the hepatitis B vaccine. When you're planning the pregnancy, plan the pregnancy 3 months after taking the second dose of the hepatitis. Now to conclude, whenever anyone is planning to get pregnant, kindly get your MMR antibody titers, hepatitis B antibody titers and varicella antibody titers checked done. If anything is negative, if you don't have antibodies sufficiently, then kindly do take the vaccine before planning the pregnancy. And the pregnancy should be planned after 1 month in MMR and varicella, whereas in case of hepatitis B, you can plan after 3 months. In the pregnancy, what all vaccinations if you have to take is like flu vaccine is allowed before planning the pregnancy and also during the pregnancy. So hence, before planning the pregnancy, please go and meet your gynec. They'll get evaluated and give your vaccines.